EpiPen prices shot up. Basically, EpiPen was a drug that treats severe allergic reactions. And it had been basically at a wholesale list price for $300 for a pack of about 2, I think. And then CEO just chose to sort of shoot it up to $600. Now, besides this being the less eccentric Martin Shkreli, which the CEO of Mylan is, Heather Bresch, and also being a terrible person like Martin Shkreli, you really do have to ask yourself, like, we have an entire healthcare system which is still built on entirely gouging consumers and profiting parasitic middlemen and health insurance delivery companies. So it's sort of obscene and amazing that a life-saving drug in some cases for some children is even in this market game to begin with. But that said, even in a totally corrupted, perverse, yes, I guess this is a part of neoliberalism that I don't support, neoliberal system, this company in EpiPen and Heather Bresch stands out. So here she is on Squawk Box, CNBC Squawk Box, which is really amazing. Matt was kind of pointing out before the show, it's almost like as if other plutocrats are like, could you not be so utterly obscene and transparent that you blow up our spot on this entire obscene cartel that we run? Here she is explaining her price gouging.
When you are having a severe allergic reaction, you need EpiPen in seconds.
But surely, Heather, you must understand the outrage. As somebody I talked to last night said, people are outraged because it seems outrageous that the American Medical Association has said this is basically the same product it was in 2009, and yet the price has gone up 300 or 400-fold.
So, look, no one's more frustrated than me. I've been in this business for 25 years.
You're the one raising the price, though. How can you be frustrated?
My frustration is
I'm frustrated because I have to be on CNBC talking about my price gouging. That's why I'm frustrated. I was looking forward to buying a couple of more homes on Nantucket and the Hamptons. And now I'm standing here talking to you.
a list price of $608. There is a system. I laid out that there are 4 or 5 hands that the product touches and companies that it goes through before it ever gets to that patient at the counter. Everybody should be frustrated. I am hoping that this is an inflection point for this country. Our healthcare is in a crisis. It's no different than the mortgage financial crisis back in 2007. This bubble is going to burst.
What bubble? What are you referring to?
So when you walk up to a counter, I think that it's fair to say anytime you're shopping for anything, you know what that product's going to cost when you walk up to the counter. Only in healthcare, and in this instance pharmaceuticals, do you walk up to that pharmacy counter, you could have paid $25 yesterday, and you're paying $600, $1,000, $2,000. Deductibles went overnight. What's coming out of a patient's pocket went from $100 to $3,000.
And all they know is, and listen, let's be fair, and you know this, I mean, mom and pop, when they go to a Walgreens or a CVS, and they have to punk down $500, $600 for an EpiPen, and they see Mylan on it, do they care about all those other people making the cut?
No,
they don't.
And they shouldn't care.
Blah, 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 blah. Verbiage. Jacking up prices, endangering kids' health. Under pressure, Mylan is going to increase financial assistance and help, apparently, with out-of-pocket costs.
We need to start threatening to nationalize some of these companies.
I agree. I agree, actually. I agree. There is a massive national health process, and we immediately need to have a nationalized universal healthcare system of government delivery. I agree. And I could see a bright future for her as a mid-level administrator in a national health plan.
Hello, you. I'm Sam Seder. Looking for smart progressive talk that is occasionally amusing? Well, subscribe to our YouTube feed. Subscribe to our podcast. Like us on Facebook. And just generally enjoy us.